Good morning and welcome to Daybreak USA. Thank you for waking up with America's original radio news magazine. Joining us this morning is an addiction specialist for CRC Health Group, the nation's largest substance abuse treatment provider. Dr. William A. Jamack is a psychiatrist, currently the medical director at White Deer Run Drug and Alcohol Treatment Facility in Allenwood, Pennsylvania. Dr. Jamack, welcome to Daybreak USA. How are you doing this morning?
I'm doing well. Thank you very much, Scott.
Well, we need to talk about something that is indeed an issue that bears focus and attention, and it has to do with millions of Americans who are struggling with addiction. And we're talking 2 million Americans, latest statistics showing, that are abusing or are dependent on what are known as opioid drugs. Give us some explanation on this and how CRC is mounting an attempt to try and stem this tide of abuse.
Absolutely, Scott. And I believe your numbers are actually a little bit of an underestimate. According to SAMHSA's National Survey on Drug Use and Health, there are now 16 million Americans who have abused prescription drugs or heroin, and that was from 2008, ages 12 years and older. Obviously, this is a huge problem. We're not only talking about heroin, but prescription pain medications and so forth. Here at CRC, we have been treating opioid dependence for quite a long time, obviously, and we're, like you said, the nation's largest drug treatment provider. If patients out there do have a problem, we have a phone number to call, 866-575-8186, or you can reach us on the web at seekhelpnow.com. Recently, we've begun to utilize a very new and novel treatment approach to helping opioid-dependent patients reduce their risk of relapse. You may have heard of the medication Vivitrol, Scott. It's been around since 2006, and it's been used very successfully at our facilities to treat alcohol dependence. We've had very good results with this medication. It's been very well tolerated, and it's helped improve outcomes for alcoholics. In October, it was FDA approved to help opiate-dependent patients and reduce their risk for relapse. And I'm proud to say that CRC is one of the leading companies in utilizing this new treatment modality. Basically, what Vivitrol is, it's an injectable medication. You get an injection once a month. And what that really does is it prevents the opiate-dependent patient from needing to make a treatment decision every day. In terms of going to a Suboxone clinic or a methadone clinic, they can now get an injection once a month, and that can prevent or reduce their cravings to use. It's obviously not going to work alone. They need to continue a program of recovery, including counseling and meetings and a variety of other treatment alternatives, but this certainly increases or improves their ability to maintain sobriety and abstinence. The nice thing about this medication also, Scott, is that it's not addictive. So for the first time, addicts have an opportunity to utilize a non-addictive medication that does not cause them to feel intoxicated or impaired and to reduce their risk of relapse. We're really excited to offer that treatment here at our facility and all throughout our facilities in the country.
We're talking to Dr. William Jamack. He is an addiction specialist for CRC Health Group, the nation's largest substance abuse treatment provider, talking about the FDA-approved Vivitrol. Now, Dr. Jamack, what is it that's driving the increase in the use of opiate drugs?
Well, obviously, Scott, increased availability. I mean, I believe that, heroin is now much more available than ever before. And on top of that, many people throughout the United States have become addicted to pain medications. Prescription drugs are the new heroin. We're talking about people who may go in for legitimate medical reasons and then find out that they get hooked on things like Percocet or OxyContin or various other opiate pain medications and cannot get off of those medications successfully. And before you know it, that leads. I'm sorry?
Jamack, there also have been instances that have been documented in which people have been prescribed medications like these for which they've ended up over-medicating or have gotten prescriptions that have been ill-advised on the part of physicians. Does that play a role in the addiction?
Oh, absolutely. Yeah, obviously these medications are highly diverted. There are many instances where patients seek these medications on the street, forge prescriptions, and or find doctors who are more likely to prescribe them than other doctors. So, there's a variety of ways these patients obtain their medications once they become addicted or hooked on them.
So as we wrap up, Dr. Jamack, Vivitrol, its main benefits to those who are fighting addiction to these opiate drugs, the fact that, number one, unlike it being a daily medication, it's a once-a-month administration, correct?
That is correct. Yep. Once a month. Go ahead. I'm sorry.
And the other major benefits of this drug?
Well, again, I think to me, the other major benefit is that it's a non-addictive medication, and it truly gives another option for opiate-dependent patients to be totally abstinent and to reduce their risk of relapsing into drug use.
Well, there are, as you pointed out earlier in the onset of this conversation, Dr. Jamack, millions that are dealing with a problem of addiction to not just hard illegal drugs like heroin, but drugs that can be found in medicine cabinets everywhere. And for those who would like to seek more information about our discussion, go to seekhelpnow.com. Dr. Jamack, thank you so much for the time this morning. We appreciate the information.
And thank you, Scott. You have a great day.
Thank you. Now stay close. Daybreak USA is rolling on in minutes.